Why do some patients with type 2 diabetes have high blood glucose levels in the morning?
The fasting glucose level can be high when they ate high carbohydrate foods before sleeping. Diabetes drugs might not sufficiently reduce the glucose level during the sleeping time if the drug dosage was not enough. There are also two lesser-known reasons: the dawn phenomenon and the Somogyi effect.
Let's talk about the dawn phenomenon first. What is the dawn phenomenon?
The dawn phenomenon includes hormone release linked to the circadian rhythm and wearing off the diabetes medications. The body releases hormones like cortisol and glucagon in the early morning since the blood glucose level tends to be low. Cortisol and glucagon make the liver convert glycogen into glucose, called glycogenolysis, and the synthesized glucose is released into the bloodstream. When glycogen is not available anymore, visceral fat begins to be converted into ketone bodies, which are alternative fuels for the body. Cortisol also blocks insulin secretion and insulin signaling, which results in higher blood glucose levels in the morning.
I see. There are multiple reasons why blood glucose level is low in the morning. What is the Somogyi effect?
When a patient's blood glucose level between 2 a.m. and 3 a.m. is consistently low, hypoglycemia, the body releases hormones such as cortisol, adrenaline, and glucagon to increase blood glucose levels. The rebounded blood glucose level can be high, hyperglycemia. So, the Somogyi effect is also called rebound hyperglycemia.
Then, do they have to measure blood glucose levels to check the Somogyi effect between 2 a.m. and 3 a.m.?
Yes, it is typical that doctors may ask the patients to check their blood glucose levels between 2 a.m. and 3 a.m.
How can they prevent the Somogyi effect?
They can measure blood glucose levels before sleeping. When they find low blood glucose levels, they can eat light carbohydrates. The low blood glucose level before sleeping can be due to evening exercise or the high dose of diabetes medication.
Once they have high blood glucose levels, what can they do in the morning?
They need to try to avoid carbohydrate foods in the morning.
Thank you for the helpful information. If this video is also helpful for viewers, I would like to ask them to subscribe here and watch other related videos. Thank you again. See you soon.